So, many people come with a umbilical hernia and they ask us, should we do for a, let's say, a suture repair, or we have to put a mesh, whether mesh is a necessity. Now, there are two conditions where we either put a mesh or we don't put a mesh. Conditions where we put a mesh: straightforward hernia case, no complication, patient has walked in with a hernia defect, willing for surgery, we plan electively and we repair the hernia. Surgery is not complicated, not too much of bleeding, no handling too much of the intestine, no injuries to the intestine. We release the hernia, we suture the hernia and we put a mesh. Again, the mesh, whether it's open or laparoscopic, there are two different types of surgeries. We can discuss that in another video. Now, coming to when do we not place a mesh, it's important. Example, let us say a person has a hernia for a long time, they have come with a severe abdominal pain and the intestine has got stuck. When we do the surgery, we notice there is an intestinal hole or a perforation. That time we do not put a mesh. Or let us say there is lot of any infective fluid, the skin of the hernia has changed a lot. It may not be wise to put a mesh that time. That time we close the defect with sutures and we leave it. And if required at a later point of time, we may have to repair it again with a mesh placement. See, mesh is a artificial device or an implant that comes. It is normally, there are different varieties of meshes in the market. A standard mesh normally is placed within the abdomen and it integrates within the muscle, or let us say below the muscle, it integrates into the body and it remains in place. Yes, it does shrink in size to some extent, but it normally remains in size. There is a lot of research going on saying that they are trying to get up complete biodegradable meshes where it remains within the body for, let's say, a year and then slowly disintegrates. So that probably in future that may be the line of treatment, but for now these meshes are permanent and they remain in place. Now, again, we do not place a mesh. Let us say if the patient has a large ascites, they have a liver problem, they have fluid in their tummy and we repair the hernia. That time placing a mesh may not be a great idea. That is a call of your surgeon, but most conditions, most of the surgeons don't place a mesh that time. They just repair the defect and wait for the liver improvement to happen, and in case there is a good improvement, then you can think of a mesh placement at a later stage. So, hope this clears your doubts regarding whether to use a mesh for a hernia repair or not. Thank you.